Hello, my name is John Crowley. I'm a physical therapist here with McLean County Orthopedics Physical Therapy, and today I'm going to talk to you about some back pain. Before we start, just know that this exercise and these videos are not intended to diagnose, nor should they replace regular therapy or physician visits. So, talking about back pain, the presentation could be back pain, it could be some sciatica or leg pain or calf pain. This is a general exercise we use widely in a clinic to start to get people moving and to help decrease that pain, or maybe even get it to come out of the leg and decrease the pain in the low back to help promote healthier movement. Indications are pretty widespread. Like I said, any increased back pain, tightness, soreness, stiffness, anything pain-wise into the buttocks, down the legs, sciatica-style symptoms. Contraindications, only a few, and that would only be if you have done this exercise a couple times and it makes symptoms worse, or it seems like it increases symptoms going down the leg. Then I want you to go ahead and stop, contact your physician or clinician, and discuss alternatives for this. Otherwise, this is very safe exercise to complete. As you notice, Tessa here, our model, is laying supine. She's unloaded. She should be in a very relaxed position. If this seems like it's something that you cannot do comfortably, lay down. Slowly work into that and see if you can do the exercise. If not, work with your therapist or physician on other alternatives. So to start the exercise, Tessa's laying down. We're going to have her go ahead and bend one leg up. Now, it's very important that we keep most of her body relaxed. The whole goal of this exercise is to actually promote movement through the spine and the hips and get tightness out of the low back and get some activity back in through the hips. So I'm going to have Tessa actually shove her heel into the table. Go ahead and push down. Good. And then relax. Push down again. And when she does that, it actually creates a little bit of a lift in the same side hip. So when she's doing this exercise, I instruct that we want to drive through the heel, but what we don't want you to do is make your lower leg real rigid and keep that foot up. So keep the foot relaxed, keep the opposite leg relaxed, and keep your torso and stomach nice and relaxed. So we're going to have Tessa drive her heel into the table, and then allow that lift to happen on the same side, and she's going to turn her hips, and then back down, and then relax completely. In turning the hips, we're actually getting some rotation to happen in the low back, which is turning muscles on, and then when she comes back and relaxes, it's turning them off. And muscles should have that ability to turn on and off. Typically with back pain, those muscles tend to turn on and stay on, which is what creates a lot of that stiffness, pain, increased compression, potential aggravation to the joints and nerves and muscles and discs. So let's have Tessa go ahead and go through a couple of them, and I'll point out a few key features to this. Drive that heel down, lift, back down. You should be able to see that she's lifting at this hip and just rolling towards the opposite side hip. Her knee and her thigh is staying straight up and down. So a common mistake would be to take that with you, in which case we're getting rotation, but you're actually using your core to rotate, increasing stiffness there, and not the hip. We want the hip to be doing all the work here. So driving through the heel, coming up, keep that foot relaxed. Go ahead and do a few of them in succession. Relax all the way at the bottom and back up and back down. Let's go ahead and switch and look at it from the other side. Good. We're going to make one small correction here. It's easier to keep that leg to the outside if we keep this foot just to the outside of the hip. And then she's going to lift up and turn. This leg's relaxed. The core is relaxed. Good. It takes a few of these to get that tightness and that tone to calm down in the back. So don't be surprised if the first set is a little sore, but the more that you do, it should feel like things really start to loosen up in the back. And you should feel like things are a little bit looser standing up, and not as tight and as guarded. Typical prescription that I tend to give people is about 3 to 4 sets of 15 to 20 reps. It takes quite a few to get those muscles to start to normalize, and we treat it like it's a behavior change. So doing this, especially if it helps a lot, repeatedly throughout the day to continue to maintain that change in behavior in the low back muscles is vital. Now, Go ahead and relax that down. Sometimes people have a really tough time actually keeping that leg straight up and down when they lift and turn, and they can't help but take that over, and it's tough to figure out. So in that instance, or if they start to get cramping in the hamstrings, we're going to take the hamstrings completely out of the equation. Most of us have a 5-gallon bucket laying around the house. If not, the hardware stores usually sell them for about $3. So we're going to do that to keep the leg completely relaxed, and it almost helps in keeping it stationary. And now Tessa is actually just going to press into the bucket, lift, and twist. And I know that's difficult to see at this angle, so we'll switch sides with it in a sec. Good. And you can see the pelvis turn. That rotation's allowing for movement. And long-term help, there's 2 things that'll really help the back: movement and time. So keep moving, move often, move healthy.